I'm Abigail Spanberger, and I am proud to represent Virginia's 7th District in the House of Representatives. And I want to take a moment to speak to you directly about the Inflation Reduction Act and how it will lower prescription drug and healthcare costs for Virginians. Everywhere I go across the district, I hear from Virginians who are impacted by high prescription drug prices. And for years, Medicare has been prohibited by law from negotiating the prices it pays to drug companies. This prohibition has allowed pharmaceutical companies to keep drug prices higher than in other countries. And the Inflation Reduction Act will finally allow Medicare to negotiate with drug companies and bring down the drug prices for seniors on Medicare. Allowing Medicare to negotiate prescription drug prices will not only lower prices for people who take those drugs, but by keeping drug costs down, it will lower premiums for everyone else. This will mean more money in the pocket of the 1.5 million Virginians covered by Medicare. The Inflation Reduction Act will also lower drug costs by capping out-of-pocket expenses for those covered by Medicare at $2,000 per year. Previously, there was no yearly limit to what people on Medicare Part D paid out of pocket for pharmacy services. And now the 1 million Virginians on Medicare Part D will have the peace of mind of knowing that their total annual drug costs are capped. And before the Inflation Reduction Act, the 74,000 Virginia Medicare beneficiaries with diabetes could be liable for hundreds of dollars in cost sharing for their insulin. The bill will also cap the cost of insulin at $35 a month for all Medicare beneficiaries. And finally, the Inflation Reduction Act will save thousands of Medicare beneficiaries money by ending cost sharings for vaccines in Part D. Currently, patients receiving vaccines through Part D, such as the shingles vaccine, must pay a portion of the cost out of pocket. Sometimes that is hundreds of dollars. But starting in January, recommended vaccines will be free under Medicare Part D, and about 85,000 Virginia seniors received the vaccine through Part D in 2020, and this benefit begins in January. The Inflation Reduction Act doesn't just benefit seniors. It also prevents premium hikes on Virginia individuals and families. By extending the current health insurance premium subsidies through 2025, this law makes sure that the cost savings we have seen over the last year on the ACA exchange continues to be in place. This year, these subsidies have saved an average of $850 on health premiums for more than 34,000 Virginians in our district. And those savings will now remain in place for 3 years. At a time marked by increased costs across the board, I am proud to be working to reduce prices and help our economy recover. I will continue to listen to the people of Virginia and fight for and work for what is best for the Commonwealth.